Hello, my name is Nurse Pauline RN. Welcome to my channel. Today we'll be talking about exam 2. Please check my playlist for exam 2, part 2 and part 3. Today I'm doing part 4 of exam 2. Before I get started, please hit the like button, please subscribe, and please share my videos, please. Today we're doing questions and answers. The doctor has ordered a 24-hour urine collection. Which urine sample would the nurse discard? Which urine sample would the nurse discard? The answer is the nurse discards the first voiding of urine sample for the day. The 24 hours is ordered by the doctor, like early in the morning. When the patient wakes up, the patient will void and discard the first urine sample. If you're starting after the patient voids that urine sample, then we'll start our sampling. For example, from 7 a.m. in the morning to 7 a.m. the next day. The urine collection is a 24-hour urine collection, which is collected and stored in a jug on ice. If the ice has melted, you have to keep on changing the ice for 24 hours on each shift. Some floors may have, maybe ICU may have refrigerators to keep them on, but if you do not have a specific refrigerator to store the 24 hours urine, you have to store them on ice, not on ice water. Nurses do not depend on your text to fill that bucket with ice, because the ice may melt and the urine is there for 6 hours not being on ice, and that's not what the doctor has ordered. The doctor has ordered a 24 urine specimen which is kept on ice for 24 hours. Whether or not your tech changes it or not is the nurse's responsibility. What is the best position for inserting a Foley catheter? What is the best position for a patient when you are inserting a Foley catheter? The answer is the dorsal recumbent position. When you are asked to catheterize a patient, what should the nurse consider? Nursing consideration should be that the bladder is sterile. Catheterizing a patient requires sterile catheterization. It's a sterile procedure. All supplies, gloves, everything has to be sterile. It's completed over a sterile field. What is the name of a catheter used to drain patient's bladder for 5 to 10 minutes? What is the name of the catheter used to drain patient's bladder for short time, 5 to 10 seconds? The answer is straight catheterization. This is a sterile procedure. This we call this a straight cath for short, but the correct word is straight catheterization. That's how the doctor will order this. And the straight cath is ordered for patients. Maybe they are post-op. They are doing less than 30 cc's an hour. Urine should be greater than 30 cc's an hour, especially post-op patients. If they are not voiding their urine, that means they're receiving all these IV fluids. That means your patients are retaining urine in the bladder. And for post-op patients, the bladder will become distended, and post-op patients with abdominal surgeries are at risk for hemorrhaging. So in and out cath is a procedure 5 to 10 minutes. Your patients are not voiding. Your patient is gonna say, can you straight cath? It's a doctor's order. The doctor said the patient is not voiding 30 cc's an hour. It's 8 hours and the patient have not voided more than 50 cc's in 8 hours or 100 cc's, but the patient is not voiding 30 cc's an hour. You notify the doctor. Your doctor is going to give you an order. Everything you do, there is a doctor's order in everything you do. So the doctor said, please straight cath my patient. You'll insert, it's a catheter, it's in and out. It is not left in. Excuse me, that's why we call it an in and out catheter. We're talking about a 24-hour urine collection. What is a 24 urine collection ordered for? A urine 24-hour collection is ordered for diagnosing kidney problems. It is ordered to see how much creatinine is clearing from the kidney. It is ordered to measure proteins, hormones, in the kidneys. It is a time test. It is a 24-hour urine collection used to see how much creatinine is clearing from the kidney. It starts exactly, for example, 7 a.m. and it ends exactly 7 a.m. the next day. It's finished. Always kept on ice for 24 hours, not ice water. When you have a patient who is on a 24-hour urine collection, they will void in the urine containers. They do not void exactly into the jug that is gonna be sent to the lab. The patient will void into the bedpan or in the urine containers in the bathroom, and then it is poured into this 24-hour container. It's a jug, but the patient does not void directly in the jug. It is transferred from our urine containers that the patient void in, and the nurse is the only one who transfers it to the jug. What is a BRAT diet? The acronym BRAT, B-R-A-T. BRAT stands for banana, R is for rice, A is for applesauce, T is for tea, toast. BRAT diet is recommended for patients who has nausea and vomiting, diarrhea, or stomach problems. What is the correct procedure for inserting a rectal tube? I did tell you in my past videos, a rectal tube is like a Foley catheter. It has a urine drainage bag that you attach on the frame of the bed. And you insert it into the rectum. For example, patients who's having a lot of diarrhea, especially a patient who has C. diff, and you're trying to containing the stool. You won't have that much cleaning up to do. You'll insert a drainage bag into the rectum, and it will drain all the way down. It's liquid stool. A rectal bag is inserted only for patients with rectal stool, so it's able to drain down into the bag. So they're saying for inserting your rectal tube, the correct procedure is introduce the tube beyond the anal canal into the rectum about 10 centimeters. Individuals with which blood type are universal donors? The answer is type O. Type O donors are universal donors. They can donate to everyone. What kind of technique would you use for suctioning a patient with a trach? A patient with a tracheostomy tube. A patient with a tracheostomy tube, you would suctioning them using sterile techniques, sterile gloves, sterile equipment. Is a sterile procedure. The body eliminates excess sodium through which organ? The body eliminates excess sodium through the kidneys. The electrolyte, which primarily controls water distribution throughout the body, is sodium. Sodium is the electrolyte which primarily controls water distribution throughout the body. The most abundant electrolyte in the body is, your answer, calcium. Calcium is the most abundant electrolyte in the body. Patient with fluid volume excess, where would we assess for our assessment of fluid volume excess? We would assess patients for distended neck veins. Patients with distended neck veins has excess fluid volume. There are 4 types of wound drainage. Do you know your 4 types of wound drainage? They are serous drainage, sanguineous drainage, serosanguineous drainage, and purulent drainage. Please hit the like button, please subscribe, please share my video. Thanks for watching. Stay tuned to part 5 of exam 2. Thank you. Have a good day.